So to move back into push-ups, it's best to start off the wall and gradually go to something that's more lower. So the key things, first of all, is to set your scapula. So I'm actually pulling my shoulder blades more together, as if I'm pulling the shoulder blade back and down into the opposite back pocket. So I'm pulling around that way on both sides. So it'll be like you kind of have short arms there. So I'm not out there like that. Taking some steps back, so there's a bit of a lean there. About shoulder width for the hands. The body is straight, so I don't want my body to do this, and I don't want it to do this, and I don't want my head especially to do this. So the pelvis for a lot of people needs to be a little bit tucked under. So I'm going that way. If I made it real obvious, I'm like tucking under there, because a lot of people feel like their back is actually curved that way. So I want to tuck under a little bit there. Then imagine like there's a balloon coming out through the top of your head, pulling you out this way. So there's a gentle elongation through the whole body, so there's a line through your whole body. So we want that there first. And the back of the head and the back of the neck sort of move back a little bit there. Not excessive, but they're not leaning forward here. So there's a little impulse going up here, back of the head and neck back. Then we keep that alignment, shoulder blades back, keep that alignment coming in. May not be able to go all the way in to start with because of pain. So you just stay shy of pain. And throughout the whole exercise, I'm keeping my shoulder blades pinched together at this stage. And you're going to where you feel that's enough, you're sort of fatigued. Might be 5 if you're really deconditioned with it, up to 20. And then we go into something that's a bit lower, so maybe something about this height. All the same requirements, your body's straight, pelvis a bit tucked, along through here, back of the head and neck back. Then gradually going down onto a chair, so your body's more at that angle. Then eventually you're onto the floor. The shoulder position does change where there is movement with this over time once the problem in your spine, your neck, or your shoulder has disappeared.